Welcome on behalf of Medscape Neurology. We will be talking today about highlights from the International Meeting of the Movement Disorder Society. I'm Kathrin LaFaver. I'm a movement specialist here in Saratoga Springs, New York, and I will be talking with Dr. Indira Subramanian, who is a clinical professor at UCLA and director of the VA Center in LA as well. So thanks, Indu, for talking with us. So I have not been able to attend the MDS meeting, which was in beautiful Madrid in Spain, the first in-person meeting since 2019. So tell us all about it. What was your overall impression?
Yeah, so I think that there's still sort of a transition coming, from the pandemic and in the depths of the pandemic to getting out. I would say that one thing that I think many of us realized was just how much, it means to be able to connect in person with each other again, and how social connection for us as healthcare providers is just so key. So I think we had, in-person connection in the meeting halls, and then of course in Madrid there's opportunities for out of meeting hall connection as well. And we were able to gather together and meet for the first time in honestly 2.5, 3 years. And so I think it was very meaningful to reconnect. And I think that, the sort of pendulum has swung. The pandemic has really highlighted a number of issues around, I think, many things that we haven't been doing right historically around diversity, equity, inclusion type of causes. So there was a little bit more content around some of that. I think as the Movement Disorder Society is really a global organization, there's a huge impact of, looking at the international sort of landscape of the world with Parkinson's disease and related disorders. And so, I was able to sort of meet and greet with, for example, Dr. Okubadejo, who is the Africa section head, really inspiring a number of talks around, what the global climate is and how COVID has affected, these populations of patients that we take care of, and how we should provide, care for these folks moving forward. So it's a very interesting kind of climate to go to a meeting around.
That's great to hear. And, it's always been an international society, but I think historically, there's just a tendency to focus more on North America and Europe. And it's great to see to kind of bring in more diversity and meet needs of people in other aspects in other parts of the world, for sure. Now, before we talk more about some scientific updates, I was very, very curious about the task force that you are chairing that is centered around wellness for Parkinson's disease. So why don't you tell us about that?
Yeah, so I mean, I think this is a really exciting time. You and I, Kathrin, believe that lifestyle choices that patients make every day can make a difference, not just in Parkinson's disease, but many, many disease states in medicine in general, including many other diseases in neurology, ranging from Alzheimer's disease, headache. The lifestyle choices and prescriptions is part of the dialogue of counseling, but we haven't really focused on this in the Parkinson's world. I think many of the times our patients tell us that from diagnosis, literally they walk away sometimes with just a diagnosis and a pill and come back in 6 months. And sort of the sense that, there's this very compartmentalized care, and really the neurologist is kind of driving that care, and they often feel lost about what to do in the 6 months, that intervenes between these visits. And so we've really been trying to shift the paradigm. And my hope is to really bring the concept of wellness, sort of lifestyle choices, understanding the person more holistically, the various components of health that matter, especially if you think about Parkinson's disease. A lot of what we focused on is motor symptoms like tremor, not really thought much about non-motor symptoms, let alone thinking about mental health, which is a huge part of the care of Parkinson's disease. And then really we've really just focused on just the disease, not really thinking even about the whole person. And so when we think about the wellness prescription that we are hoping to work with this task force to understand how to deliver this better and what that would include. This is sort of a new opportunity, I think, to sort of present this to our society and hopefully change the paradigm for people living with Parkinson's disease to really be much more proactive. And one of the things that I think we've done as a group is understand more about the prodromal time period of Parkinson's, and we find ways to identify genetic carriers of mutations that might lead to Parkinson's disease. And we've really not had much to offer those patients. So, what do we tell somebody who may be at risk with this percentage chance of getting Parkinson's? We don't have really disease modifying therapies. So I think the wellness prescription could fit there. And really from diagnosis, really sort of part of the counseling, a colleague of mine said, this is the sort of stuff that we might spend the last 1 minute of a 30-minute visit talking about as the patient's about to leave your office. And maybe we should really be bringing that right up front and center to caring about these sorts of choices and counseling people from, the get-go, and make that part and parcel of, what we counsel them much earlier on in that appointment, and engaging sort of a multidisciplinary team approach with people like physical therapists and psychologists and whoever touches the patient in their daily lives. And that could in many settings even be a religious leader or some yoga teacher or whoever, and engage those people in the community, understanding the family dynamic, understanding not just the person and their motor symptom, but really this much more holistic kind of approach. So I think those are some exciting things that we hope to bring. And we were able to meet with our wellness task force of 20 people. We had 200 applicants. We picked some very cool people, very multidisciplinary gang. And then we had 30 minutes to present on this to the global society, and we had a packed room. Actually, we were really excited, and a lot of people want to get involved and understand how they could do it. And I was really shocked also about the number of people that are already running wellness centers in Parkinson's disease and related disorders around the world. And we met some people who are just doing some really cool things. An Italian sailing club for Parkinson's patients. Folks in Australia that are doing Zumba together. People literally in Africa who are watching videos on the cell phone and then having a room of people in the background doing, yoga. So really kind of cool things that are happening worldwide. And I think we have the opportunity to engage more of a multidisciplinary group of folks, allied health professionals as well, that the society is now being proactive about welcoming to our membership as well. And so I think we're really, trying to get as much sort of headway in some of these spaces and really hopefully work together to make a difference. Part of the wellness prescription is also this cultural context. So understanding who the person is. Are they a woman? Are they young? Are they a person of color? Are they living in a place where they have, very low socioeconomic sort of abilities? And, can they even get levodopa in parts of Africa, for example? So, what are the basic things that we can teach anyone who may not have resources around diet, exercise, sleep, social connection, mind-body approaches, things like that, to really meet people where they are and to help them, live better with their Parkinson. So that's sort of our hope. And so our task force, we're going to be doing a survey to all our members of the MDS, and then we'll be gathering that information and writing a paper on where we are now in terms of, the evidence, and then hopefully work together to, create a prescription. And stay tuned, because I think, even if you're a general neurologist or somebody who might be working out there, we realize that in many parts of the world, people who are seeing patients from diagnosis are not a neurologist even. I heard a statistic that in the US, 50% of Parkinson's patients don't see a neurologist in their first 4 years of disease. And so we have to really, expand this message to, I think, primary care physicians, geriatricians, many types of doctors that might be meeting our patients and giving them the diagnosis. So I think I'm very excited about this task force.
Wonderful. Well, I'll be looking forward to see what's going to come out of this, and really opening the minds and, being more proactive, empowering patients. I think that's all a wonderful message. Thank you so much, and have a good rest of your day.